Hello everyone, welcome to Niman's Digital Academy. Myself, Dr. Sumit Kumar Durgoji. I'm a senior resident in psychiatry here.
Good morning. My name is Sandeepa. I'm a clinical psychologist here.
Our today's session is focused towards demonstration of mental status examination in psychiatric. So, as you know, the steps of mental status examination includes general appearance and behavior, then speech, and then thought, and then we'll go assess the person's mood, perception, and then cognitive functioning, and then we'll assess the person's insight and judgment. So these are the basic steps of doing the mental status examination. So now we'll go assessment. We'll tell briefly about what is this heading mean, and then how to practically ask questions to a patients. First, coming to general appearance and behavior. So as the patient walks to your clinic, observe him. What is his? How does he appear? What is his dressing, grooming? Does the patient makes eye contact or not? Is he comfortable with you? Is rapport established with the patient? Also observe for any involuntary movements and gait. It is important to observe these things because supposing if we come across a patient with mania, the patient may be wearing very bright, colorful dresses, or if the patient is coming with he's unkempt, untidy, wearing very poor clothes, it may indicate signs of depression or anxiety. And also, when you are checking for appearance, whether the patient appears whether the patient appears anxious, that could indicate some anxiety spectrum disorders. And also, you'll evaluate for the signs of malnutrition. Sometimes in disorders like schizophrenia, the patient acting out behavior out of the persecutions may not be eating for a long time. That can lead to malnutrition. Also, you will check for nicotine stains because there is increased risk of tobacco use disorders in persons with schizophrenia. So these things needs to be kept in mind. And when you're checking for involuntary movements, this could be side effects of the antipsychotic medications what the patient may be taking. So in general appearance and behavior, these things needs to be looked at. Now coming to the assessment of speech. So how you will assess speech and what are the components under speech which you will assess. So basically in speech, you look for tone, the tempo, the volume of the speech, whether it is relevant, coherent, and the prosody. The best way to assess is by asking the patient, by taking a speech sample. So to take the speech sample, we can give a neutral topic, and this same speech sample can be used to assess even the thought process of the person also. So let us ask patient so you can ask something like, can you tell me something about can you describe topic on Diwali? So I'll be giving a neutral topic. So can you speak for some time about this?
Okay. So when we ask the patient, we can ask the patient that can you tell us a little bit about Diwali? So here I'm acting as patient and I'll be talking about Diwali here. Diwali is a festival of lights. It actually started because Lord Rama had returned from Sri Lanka after killing Ravana. Ravana was a very bad person. He took away Sita from Ram and he was a very bad man. And he really deserved to die. I just don't understand why he did all these. Maybe he had some psychological problem, I guess. Sri Lanka, I really want to go there. I heard it's a beautiful place, and probably I'll really enjoy going there.
So ideally, such speech sankhya, either you note down the exact verbatim of the patient or you audio record it. So here, this gives an insight into, here we can look for tone, and what tempo means, what is the flow of the speech, volume means number of words per minute. Roughly you can tell, because in patients with anxiety or mania, the number of words per minute may increase, and whether it is relevant. So here she was talking about, initially she started with a festival and then she moved to Sri Lanka. So there was some disconnection between the initial part and the later part. So probably it was some loosening of associations that we'll cover under the thought. And then the intonation in the speech is called prosody. So whether it is maintained or not, and whether it was relevant, whether she spoke something relevant to the topic, and whether what she spoke, was it understandable by you. So that is called coherence. So these are the basic things you look under speech. Now we have already taken a speech sample. The same speech sample we can be used to assess thought process. So how best you can assess thought? So in thought, you'll assess it mainly under the 4 headings. That is the form, stream, possession, content. Now, what does form and stream mean? So here, stream is the flow of ideas, how the person is talking, and whether there is a good continuity in his speech or not. Form means whether the content of the speech is organized or not, whether the patient is able to organize his thoughts and speak in a meaningful way or not. So the disorders in the problems with respect to form can lead to formal thought disorders that can give rise to the circumstantiality, the tangentiality, or there may be thought blocking. Circumstantiality means you give the patient a neutral topic, and the patient will include lots of irrelevant details while speaking, and ultimately reaches the point, but there will be inclusion of a lot of irrelevant details. In tangentiality, you give a topic, the person speaks something different from what the topic is being given to him, or the person may experience sudden pause in his talk. So that pauses are called thought blocking. So these are various types of formal thought disorders. Or the person may continue to repeat what the examiner is telling, so which is called perseveration, commonly seen in conditions like schizophrenia. So now coming to what is possession. So whether the person considers his thoughts as his own thoughts, or that he feels that his thoughts are being influenced by some external agency. To assess this possession, we can ask, do you experience any thoughts that that are repetitive in nature, that are dominating you in your mind, or does it appear senseless to you? Do you experience any of this?
Yeah, sometimes a thought keeps coming in my mind whether I have locked the door or not, and because of this I keep going and checking the door, and though I lock it, but still every time it comes in my mind that I have not locked, even if I try to tell myself that no, I have checked, but still there's this urge to go and still check whether it's locked or not.
So here the patient is telling about expressing obsessive thoughts leading to compulsive behaviors. One more component under possession is thought phenomenon. So here that includes thought insertion, thought broadcasting, and thought alienation. These are typically seen in schizophrenia. The person may experience as if his thoughts are being controlled by some external agency, as if somebody is trying to insert, remove, or other people are trying to know about his thoughts before he tells them. So in order to ask this, first we'll ask an open-ended question to the patient as to whether they experience any unusual experiences, and then if yes, then we can proceed further. So we can ask something like, do you experience any unusual experiences of late?
Like what kind of unusual?
Do you feel, do you own your thoughts? Do you feel your thoughts are being controlled by some external agencies?
Not like that my thoughts are being controlled, but recently I have experienced some really unusual thing, like I hear two people talking, and when they are kind of arguing with each other, blaming each other, and when I tell my family members about it, and they say that there is no voice, but I can hear them.
So you can hear voices which are not being heard by others?
Yes.
Okay. Where do these voices come from?
It comes from those two people who speak.
Does it come from a nearby place, or does it come from a far off place?
Like nearby.
Okay. So what do these voices tell you?
They are always blaming each other. They are fighting amongst each other that you are bad, you are not doing it correctly. So they are constantly fighting among themselves.
So here the patient is basically expressing hallucinations. So that I will be covering in the subsequent my interview session. So that is about the possession of the thought, and then you should note down the content of the thoughts. So in content of the thoughts, what the patient is actually expressing. A patient with depression can express suicidal thoughts or attempts or thoughts of harming oneself. Or the a patient with schizophrenia who's having a persecutory delusions can experience that somebody is trying to harm them, police are behind them. So these things needs to be included in the content of the thought. So this is about the assessment of thought.